Hey everybody, this is Dr. Langdon, board certified pediatrician, mom of 6 and grandmother to 2, with an interesting talk today. This is primarily for parents and for older teens, or as per your discretion, you feel like sharing it with any younger teens, that's up to you guys. I want to share with you today some of the concerns I have for teens. There are many of them. I believe that they often have horrible sleep hygiene. I believe that they are being intimidated and have poor self-image and all kind of self-esteem issues because of social media. So there are a host of things to talk about. The current state of anxiety and depression and successful suicides is horrifying. But today's topic is sexually transmitted infections. And I'm going to try to quickly go through my main concerns medically and even emotionally. So medically, the way that we try to teach patients is basically that any form of sexual activity can transmit infections. And I am not trying to be crass. I am a Christian pediatrician, but sometimes if we gloss over things, those kids end up getting infections or pregnant, or all kind of things can happen. So let's just be very practical here. I think of it when I'm talking to my teen girls as, you have 3 possibilities, oral, vaginal, or anal, and all of those possibilities can allow for transmission of sexually transmitted infections. We used to call them STDs, diseases, but because so many of them are treatable by antibiotics, thank goodness, they're more of really an infection. So now we call them STIs. And so I think it's important to note this because a lot of teenagers feel like if they are not having the traditional form of sexual intercourse, that they are not at risk for catching anything, and that is absolutely not true. That's part of why now we really recommend the Gardasil vaccine to protect against human papillomavirus, because human papillomavirus is the cause of all the oral, mucosal, esophageal, throat, tongue, lip, gum cancers. And so the vaccine could help prevent some of those cancers. And technically that is a sexually transmitted infection. HPV is. Now, so I want to teach the teens that it is in their best interest to postpone what we call their sexual debut. So we know that the sooner teens begin engaging in sexual activity, the more partners they could in turn have over a lifetime. My goal, I think a lot of parents' goals, would be for them to have lifetime mutual monogamy. That's what I practice, but I know I am very unique. A unicorn, you might say, very rare. And it's a wonderful blessing. Not only is there no risk of sexually transmitted infections, there's not even any baggage from previous sexual relationships. But that may be not realistic. So for today, we're going to talk about the importance of postponing sexual debut. The older they are, the better. Because when they're young, they're more likely to have a total higher number of partners over a lifetime. They're more likely to be taken advantage of. Maybe they just have poor self-esteem and they're saying yes to sexual activity to get friends or to gain favor or because they don't feel good about themselves, which is terrible. Here's another thing I worry about, and that is, becoming sexually active is a very adult-like thing, and teens don't yet have a very well-developed prefrontal cortex, right? And they can't make wonderful decisions and maybe don't see danger where danger is there. And it makes us worry about their ability to make such a mature decision. Well, imagine if they take it up to the adult level relationship by being sexually active, and then there's a breakup, as almost always there inevitably is, and then they have these devastating emotional consequences and can be more heartbroken and have even more reasons to have depression or anxiety. So I worry about the emotional consequences of premature sexual activity as well. So what I try to tell the teenagers is you've got to plan to not become sexually active if you don't truly want to be, if it's not a safe relationship, if the partner is not monogamous, if you're not always using protection. So let's talk about that. There are 2 things we need to protect against. Well, there's a bunch of things we need to protect against, but particularly sexually transmitted infections and pregnancy. So for pregnancy, typically in teens, we will use birth control pills, but there are also a host of implantable options, including IUDs. Not that your primary can do that. Your primary can do oral contraceptive pills, mostly only. Remember, the teen girls don't have to have a pap smear or a full pelvic exam until they're 21 years old most of the time, based on ACOG, American College of OBGYN guidelines. Now, so we want to prevent pregnancy. That's important. We also want to prevent sexually transmitted infections. And to do that, you need to not be sexually active, be abstinent or postpone sexual activity, decrease the total number of partners over a lifetime, but also each and absolutely every time need to use a barrier method, such as a condom, to prevent transmission of sexually transmitted infections. Now, there are certain things like pubic lice that really the condom doesn't help much against. Some infections are lifetime, like herpes. There is a treatment for herpes. There's not an absolute cure for herpes. Most infections we can screen for at well visits or when you come in with symptoms with just an unwiped specimen into a urinary cup. We can send it off to the lab, and in a few days we'll get back. Especially gonorrhea and chlamydia are the ones we see most often around here and are very frequently transmitted, so we frequently screen for those. Certainly we would also worry about herpes. We would worry about HIV. We would worry about syphilis. Several infections we would worry about, but those are probably the most common ones. Gonorrhea and chlamydia are the very most common. Now, it's not just in teens. There's a whole outbreak of STIs among the very elderly population these days, so that's a concern as well. So it's important to have safer sex at all ages. And now remember, none of it is safe sex other than no sex unless it is in the context of a long-term committed, mutually monogamous relationship. And I often will have teen girls who say, well, we don't use condoms because he says he doesn't like them. Can I just get all editorial and a little bit feminist here? The girl is the one that's going to bear the brunt of these bad decisions, as far as she's the one that's at risk for getting pregnant. She's the one that could have scarring of her fallopian tubes from having infections that could render her then later infertile. The boy's not going to have a whole lot of damage usually. Now, certainly you can have complications and consequences, but for the most part, girls bear the brunt of all this. So if that boy doesn't care enough about you to even use a condom, he doesn't care about you at all, and he's only using you. And I see this so often in my teen girl patients, and it hurts my feelings and makes me want to beat up some of those teen boys out there. So I just want to tell your parents out there, please talk to your teens. Please make sure you're staying in a close relationship with them so you know what's going on with them. And those are the main things that I'm worried about: infection in pregnancy, hurt feelings, baggage for future relationships. So it turns out it really makes sense medically and emotionally and socially to postpone that sexual debut as long as possible. I hope that was helpful as usual. If you guys have questions, feel free to let me know. Thanks.